The the action of orbicularis oculi muscles is to blinking reflex. It may be voluntary, involuntary. It also provides the pumping mechanism of tear. Pumping by orbicularis oculi muscles, tears move into the punctum, from punctum into nasolacrimal sac, from nasolacrimal sac into nasolacrimal duct, which open into the inferior meatus of nose. Below the orbicularis oculi muscles, tarsal plates present. Tarsal plates are more numerous in upper eyelid than lower eyelid. Plate gives strength to the eyelid. Or superior tarsal plate attached with the levator palpebral superioris and orbital septum. Superior tarsal plate attached are related or communicate with the palpebral superioris LPS and orbital septum. Superior are in 10 millimeter height and inferior 5 millimeter height, and inferior tarsal plate attached with the orbital septum and medial palpebral ligament medially attached with the lacrimal crust where lacrimal sac is present, and lateral palpebral ligament is attached with the marginal tubercle, which is the part of the lateral wall which is formed by the zygomatic bones, and lateral palpebral raphe present over the lateral palpebral ligaments. This picture show epineurisis of levator palpebral superioris, frontal process of maxilla, lacrimal sac, which is present into lacrimal crust, Y-shaped medial palpebral ligaments, and superior tarsal muscle, superior tarsus, lacrimal gland. It's present here, lateral palpebral ligaments, inferior tarsus, maxillary bone. If we word the lid, superior tarsal plate gland plate look like yellowish appearance, and it consists of ducts, which is consist of duct lined with stratified squamous epithelium and the cells of acini and polyhedral cells. Tarsal gland secretion is oily. The ducts open into the lid margins, which secrete the oily secretion. Modified sebaceous gland. Oily secretion, which and the function of oily secretions lipids formed because it prevent the evaporation of tear protect the eyeball, and lubricants, it act as lubricant. Also present superior and inferior tarsal muscles which assist the aponeurosis of LPS. It is attached with the aponeurosis of levator palpebral superioris. Superior tarsal muscle assist the LPS. After the tarsal plate covered with the superior smooth muscles. These smooth muscles are superior tarsal muscles. Surgical point of view, vitellar ligaments is more important. Its appearance is white, and surgical point of view, vitellar ligament is more important. After tarsal plate and smooth muscles and deep, from superficial to deep, the inner layer covered the eyelid is conjunctiva, palpebral conjunctiva, which look like pinkish color. It formed the conjunctiva and sclera. and conjunctiva and sclera, bulbar conjunctiva and palpebral conjunctiva, and the junction of bulbar conjunctiva and palpebral conjunctiva form the fornix. In upper eyelid superior conjunctival fornix and the lower lid inferior conjunctival fornix. Arterial supply of eyelid is most important. It's supplied by supraorbital arteries arise from the orbit, supratrochlear arteries, peripheral arterial arch, marginal arterial, medial palpebral arteries, marginal arteries, peripheral arteries, infraorbital artery, and zygomatic arteries. Zygomatic arteries because it's present around zygomatic bone. Bones have no blood supply, but periosteum covering the bones have blood supply. Zygomatic arteries, lateral palpebral arteries. Palpebral mean eyelid. Palpebral mean which supply the eyelid. Palpebral arteries. It form the arc-like plexus form. It's very important, the blood supply of eyelid. It also drain into submandibular nodes.